in.
Hi, Mr. Rodriguez. My name's Andrea. I'm a Harper nursing student. I'm going to be doing an assessment of from your head to toe today.
Okay.
I'm going to start off by asking you a couple questions. Can you tell me your name and your date of birth?
Jose Rodriguez, 09/28/1997.
Can you tell me what you had for breakfast this morning?
A donut.
Can you tell me who the President of the United States is?
President Biden.
Do you know what year we're in?
2021.
Can you tell me where you are?
At a hospital.
And can you tell me why you're here?
Physical assessment.
Good. So I'm looking at the patient. He's alert and oriented ×4. His cognitive function is intact. He has clear speech, clear communication, and skin color is appropriate for his ethnicity. I'm going to start by taking his vital signs. His blood pressure is 120/80. His respiration rate is 16. His heart rate is 70. His oxygen saturation is 98, and his temperature is 98. Then I'm going to go ahead and take his height. His height is 5'9", weight is 125. His BMI then comes out to be 18.5, which is within normal limits. I'm going to check his cranial nerve number 2 using the Snellen eye chart. The patient has 20/20 vision bilaterally. I'm going to go ahead and check the size and the shape of the head. Once I do that, I can go ahead and inspect the scalp, and then once I'm done checking every section of the scalp, I can go ahead and palpate. So I can just finish inspecting, and I'm going to palpate. Now I'm going to check your face. Can you just tell me, I'm going to look at your face. Can you raise your eyebrows and furrow your eyebrows? Can you frown? And can you smile? Can you show me all your teeth? Good. And then that's cranial nerve number 7. I'm checking for symmetry. Then I'm going to go ahead and start feeling for his temporomandibular joint. You can open your mouth and put your jaw forward and to the side, other side. Good. And then I'm going to go ahead and feel for maxillary sinuses and the frontal sinuses. Any pain?
No.
Okay. Now I'm going to go ahead and move on to your eyes. I can see the sclera is white on both eyes, and then I'm going to have you look up, and I'm going to look at the conjunctiva, which is pink on both sides. I'm going to go ahead and test for cranial nerve number 3, 4, and 6. So just follow the pen light. And once we are done with this, I'm going to test accommodation. So just keep looking and follow. Good. Now I'm going to look at your pupils. So your pupils right now are at about a 6 on both eyes. And I'm going to start off with the left eye. It goes down to about a 4. And then your right eye goes down to about a 4 as well. So that's perla on both eyes. Then I'm going to go ahead and feel and inspect your nose. Any pain? And then can you look up? I'm going to look at the septum. Good. Then can you cover one nostril and take a deep breath in? And then do the same thing on the other side. Good. Then I'm going to go ahead and look at the lips. Can you open your mouth? And I'm going to look at your teeth, your gums, your tongue. Can you lift up your tongue? The floor of the mouth, the roof of the mouth. And then can you stick your tongue out? That's cranial nerve number 12. That's because it's a midline. Can you say ah? That's cranial nerve number 9 and 10. And then I'm going to go ahead and feel. I'm going to look at, inspect, and palpate the external ear. And then also look at the auditory canal on both sides. Then I'm going to do the cranial nerve number 8 test. So I'm gonna whisper something. You're just going to tell me what you hear.
Pillow. Blanket.
Okay, good. So I'm going to go ahead and start to feel your lymph nodes. So I'm going to do the preauricular, and then postauricular on both sides. I'm going to inspect and palpate your occipital. Then I'm going to move down to the submental, submandibular, jugular digastric, superficial cervical, the deep cervical chain, the post-cervical, and the supraclavicular. Okay, So once I did that, I'm going to test your neck's range of motion. So if you can just look up with your neck all the way as high as you can, look down, and then look to the side, other side. Put your ear to your shoulder, then your other ear to your shoulder. Good. So full range of motion, then I'm going to test your strength. Just push against my hand, and push against my hand, and then lift your shoulders up. Good. Then I'm going to go ahead and I'm just inspecting the neck for any enlargement or abnormalities. I'm going to feel your carotid pulse one at a time. I know a rate of 70 beats per minute with a regular rhythm. And then again, same thing, a rate of 70 beats per minute with a regular rhythm. So then I'm going to go ahead and auscultate your carotid arteries. I'm going to ask you to take a deep breath in and then take a deep breath out and hold, okay, while I listen. Okay, deep breath in and out and hold. Okay, good. Deep breath in. Sorry, not yet. Deep breath in, out, and hold. Okay, so I was doing that with the bell, with the stethoscope. Now I'm going to go ahead and I'm going to test for, that's actually for the neck. I'm going to go ahead and move on to your upper extremities. I'm going to inspect the color, inspect the characteristics, and then I'm going to palpate the temperature of your arms. I'm going to go ahead and test for range of motion. So if you can just swing your arms at your shoulders in this full circle. Okay, good. And then if you can just bend at the elbow, and bend back down. And then turn your wrists around and then bend your fingers down and bend them up. Good. So full range of motion. Now I'm going to test for strength. Can you lift your arms up both at the same time with the palms facing up? For 10 seconds. 1, 2, 3, 10. You can put it, I'm going to actually keep them up. And then just bend at the elbow and then push. Okay. Then squeeze my fingers. Good. So I'm going to finish by looking at the capillary refills of all your fingers and the profile sign. And then capillary refills and both in the profile sign. I'm going to feel the radial pulses both at the same time using my two fingers. And I'm going to check for the rate, 70 beats per minute with a regular rhythm and a 2+ pulse. So once I do that, I'm going to finish with the upper extremities. Now I'm going to move down to the chest. I'm going to inspect the interior chest. I'm going to note the respiration rate is 16 beats per minute with a regular rhythm, and the patient's breaths are normal. Then I'm going to go ahead and note that he's not using any accessory muscles to take deep breaths. And I'm going to go ahead and listen to your lungs. So if you can just take more deep than normal breaths, and then just tell me if you feel short of breath or... Okay. Okay. Let me just do that over here. Okay. So once I auscultated that, I'm gonna have you stand up, and then I'm gonna look at your posterior chest. So I'm going to inspect the posterior chest, and then we're going to do the same thing with the breaths, okay? Go ahead, whenever you're ready. Okay. Then I'm going to start, I'm going to look at your left side. I'm going to lift, and we're going to look at 3 locations. Okay. And now your, oh wait, sorry. Your left side is 2. And then your right side is 3. Sorry, can you turn a little more this way? Okay, you can sit back down. And now I'm going to move on to your heart. I'm going to start off by listening to your apical pulse, and I'm going to count. I'm going to rate the rhythm S1 and any abnormal characteristics. So I'm going to look at the 5th intercostal space down, and then midclavicular. So I hear S1 and S2. I would count for 30 seconds, and then multiply by 2 with the 70 beats per minute heart rate. And then I'm going to go ahead and listen to the aortic valve, the pulmonic valve, the tricuspid, and the mitral valve. So I'm going to start off with the aortic. The pulmonic. The tricuspid. And the mitral. And then I'm going to go ahead and do the same thing with the bell. So the aortic, the pulmonic, the tricuspid, and the mitral. Okay. So once I do that, I can go ahead and start by inspecting your abdomen. So if you can lay down, I'm going to go ahead and inspect the contour. It's flat. I'm going to stand at the foot of the bed, and I'm going to see the symmetry, which I see the abdomen is symmetrical. I'm going to go ahead and inspect the umbilicus and then any pulsation from the aorta, which would be normal. I do not see any, but if I did, it's fine. Then I'm going to go ahead and auscultate. Do you have any belly pain today? No? And then I can also auscultate the aorta, and the renal arteries. And now I'm going to go ahead and palpate. So I'm going to start off with light touches, okay? You said no belly pain, right? So light touches all over the belly in circular motion. now I'm gonna go a little deeper, okay? Okay. Now I'm gonna go ahead and move to the, can you lay down this way so you can see? I'm gonna go ahead and move on to the lower extremities. So I'm gonna start off by inspecting the patient's skin color. It's appropriate for his ethnicity. I'm gonna palpate all the way down for his skin temperature. I'm gonna look at the patient's capillary refills on the nail beds, and then do the same thing here. I'm gonna hold on to the pedal pulse on both sides, and I'm gonna note the rate, 70 beats per minute. I could count. I'm gonna note the rhythm, which is normal, and then I would say this is a pulse of 2+. And once I do that, since I'm already here, I'm gonna go ahead and test the strength of your feet. So if you can just push down and then push against my hands. Okay, and then I'm also gonna look at the Babinski reflex. So I'm gonna look for curling of the toes and look for curling of the toes. There you go. And then once I do that, I'm gonna go ahead and test for strength and range of motion. So if you can just if you can keep your legs straight and lift it up one at a time, just like that, for 5 seconds. 1, 2, 3, 4, 5, go down, and then the next one, 1, 2, 3, 4, 5, down. And then if you can just lift up, like the same way you did it, lift one leg at a time, keep it straight, and then push it out that way. Good. And then bring it down and do the same thing with the other leg. Good. And then if you can bend your knee and bring it up as high as you can. Do the same thing with the other one. Good, okay. And then I'm going to go ahead and test, so that was strength. And I'm going to check for edema. So I'm going to go ahead and check for edema on the legs. And then you can actually sit up now. I'm going to have you touch your feet to your shin. Start at the top and slide it down with the opposite. Yeah. Oh, same thing with the other one. Good. I'm going to check the strength of your knees. So full range of motion. So just extend both legs and bring them down. And then push against my hands. And then pull down. Good. And then I'm going to go ahead and test your reflexes now. So I'm going to have you put your bicep. I'm going to check your bicep reflex. So I'm going to have you flex for a little bit. Flex this way. Good. Okay. You can put it down. And then I'm going to just look for curling of the fingers. I do that again. Relax, okay? There you go. Exhale. And then if you could just flex again. Okay, put it down. Okay, so I saw movement of the, and then if you could sit up here. I'm going to do movement of the patellar reflex. So I'm going to put down. And can you hold your hands like this? Good. Okay. While we're sitting up here, I'm going to go ahead and test your sensory. So if you can just tell me, close your eyes and then just tell me whenever you feel this. Okay, and now we're going to do a sharp and dull test discrimination. So this is going to be dull, and this is going to be sharp. And just tell me which one you feel, okay? So close your eyes.
Dull. Sharp. 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 Dull. Dull. Sharp. 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 Dull.
And now can you open your eyes? And I'm going to do your hand-eye coordination. So if you can just touch your nose with your finger. And then you're going to touch your nose and then my finger. And keep going. Good. Now I'm going to have you stand up. And I'm going to have you walk to the end doing a heel to toe fashion. Okay, good. And then come back with a normal walk. Okay, now I'm going to look at the Romberg test. So close your eyes, and I'm checking for balance. Patient is balanced. Now I'm going to look at the spine. I'm going to make sure that the thoracic is convex and the lumbar is concave. I'm going to have you bend forward. I'm going to look that the spine is straight and everything's symmetrical. Okay, and then I'm going to, again, when he's standing, I'm going to look at the spine, make sure everything's symmetrical. Now I'm going to have you test the range of motion of your spine. So I'm going to hold you by the hips, and then you're going to rotate just in the spine without moving your hips, okay? Ready, go. One side and the other side. Okay. And one last thing that I forgot to do is if you can lay down, we're going to put the head of the bed at 30 degrees, and I'm going to turn the patient's head, make sure the jugular vein, there's no distension, and then turn the head and again make sure that there's no jugular vein distension. And that is actually going to complete the assessment.
Okay.
Thank you for everything.
Thank you.